Welcome. My name is David Penson. I'm the Secretary of the AUA, and I'm going to be moderating today's webinar on the pathway to publication, how to submit a successful abstract. Our goal today is really to help you write the best abstract you possibly can, maximize its chances of being accepted at the annual meeting, and ultimately maximize your chances of getting your manuscript into the AUA journals. This is a new program for us, but hopefully this is going to be very helpful to you and give you an idea of how the process works and how you can really get your information out to the urologic community. Next slide, please. I'm really lucky today. We have an all-star panel joining us. John Denstedt is joining us today. John is the immediate past AUA secretary. He's the president-elect of the Endo Society, and you almost don't have to introduce John Denstedt. Rob Siemens is the editor-in-chief of the Journal of Urology, and Stacy Tanaka is the editor-in-chief of AUA News. I think all these individuals have some very unique perspectives, and they'll take a moment to introduce themselves a little bit more when they present their information. Next slide, please. So I think I will lead it off, and I'm going to tell you a little bit about what are the components of good abstract submission. And I get this question a lot every year from residents at my institution. I'm at Vanderbilt University Medical Center. I'm the chair of the department here. And, the first thing I always tell folks is you need to remember you have limited space here. And so you have to choose your words very wisely. And really what you're trying to do, particularly when you're submitting an abstract to the AUA meeting, is making the case to the reviewers that what you're showing is important and is going to have an impact on urology, your methods, your results. That's going to change the way we practice, even a little bit. And I think that if you keep that in mind, you're going to have a much better chance of writing a very good abstract. And so in that regard, what makes a submission complete, compelling, and appealing? Well, novel research. Something that's new that really hasn't been done much before. Sound science. You want to have a confirmatory or a null hypothesis, a well-written story, and think about how you will continue to share the research after the abstract presentation. I'll go through the individual parts for a moment, and then I'll turn it over to Dr. Denstedt. When people ask me how they do this, the first thing you have to do is you need to write an introduction. The introduction, when I try to write these, is one or at most two sentences. The one sentence that really should be there is the goal of the study. What is the question you were trying to answer? One word answer is a one sentence reworded question is the way to go here. And most frankly, I think you only need two sentences here, in my opinion. Others may disagree. You can have an additional sentence that summarizes the controversy. I know this may be a little different with basic science abstracts like this one you see here, but for clinical research, which I think most of us are focused on, the introduction should be pretty short. You don't have to tell people, for example, that prostate cancer is the most common solid tumor among American men. This is an audience of urologists. They know that. When you go to the methods, which is the next section, it's very important to describe your data source. You can see that here in the methods. Where did these samples come from? Where does the data come from? You want to include a brief description of the study design. You want the reader to understand what you did. It doesn't have to be in great detail. How many cc's of this or that did you use? How many questions did you ask the participants? But you need to give the reviewer an idea of what you actually did. You want to make things clear, but again, you want to be concise. You have limited words. People always ask about whether or not they should be including information about statistics. The answer is not absolutely necessary, but it's often a pretty good idea. And you really only need one sentence. For example, if you're doing clinical research and you're doing a multivariable analysis, did you use logistic regression or proportional hazards, for example? You don't have to spend a lot of time on this. With regard to the results, this is really the most important part of any abstract. This is really where you're presenting what you found and what the results mean. It really should be the longest section of the abstract, and as you can see here in this particular example, it is. You want to include the number of participants here. Some people will put it in the methods. I prefer to put it here personally. An important point, this is a little pet peeve of mine. We see a lot of survey research that's coming into the annual meeting, and people will often forget to mention anything about missing data and response rates. And so please, if you're doing clinical research, let people know about missing data response rates. One of the nice things about the AUA abstract submission is you can submit graphics, and often, one picture is worth 1,000 words. You don't have to repeat what's in the graphs and tables. People will do that. It's a waste of words. But don't rely on the graph so much that the reader doesn't understand what's going on. If the key point is in the graph, say, here, findings from our surgical outcomes are presented below, so people know what to look for. And yeah, if you can use the graphics, you should, because they save space. Finally, with regard to conclusions, these are short, highlight one or two key findings succinctly. You don't have to add the further research is needed. Further research is always needed, and there's no need for references in the abstract. I think if you keep those points in mind, you'll be able to write a short and meaningful abstract, which will really help people, help the reviewers to understand what you did. And with that, I'm going to turn things over to Dr. Denstedt to cover the next piece. Next slide, please. And Dr. Denstedt.
Okay, thanks, Dave. So I was asked to just speak about the review process for the abstracts, which on the one hand is a bit of a complex process, on the other it's fairly straightforward. So we generally receive AUA about 6,000 to 7,000 abstracts per year for the meeting. And from that, the abstracts that are accepted is about somewhere between 34 and 38% overall of the submissions. And that's been pretty consistent over the years, that acceptance rate. And that would also include the videos, which there's about 300 or 400 videos. And then in terms of the process, of course, the abstracts are submitted by topic, of which there's about 35, plus or minus. So prostate cancer, stones, et cetera, et cetera. And then all of the abstracts are reviewed by teams. And there's about 85 or 90 teams who review the abstracts. So some of the categories receive so many submissions, for example, prostate cancer, that it really requires more than one team to assess those and score the abstracts. And of course, it's entirely a electronic process in terms of management. So when the abstracts are assessed, there's a scoring category. So it goes one to 4, 1 being outstanding, 2 being good, should be on the program, 3 good, can be on the program if there's room, and 4 unacceptable. And the teams will work their way through those abstracts and provide appropriate scoring based on the quality of the science. And then each team, and there's I generally tried to have at least 5 or 6 people on each of the teams to review the abstracts. If you drop down to 2 or 3 people on each team, it's just, you're not getting enough opinions, if you like. So generally tried to have at least 5 or 6. Some of the teams have 10 or 12 people involved in this process. So the total number of people is about 700 or 800 who contribute to this assessment process. And then every team has a team leader. So once all of the scores come in, the team leader then starts to put the sessions together. So picking the top ranked abstracts, those that are outstanding, those that are very good, should be on the program. And then we'll begin to assign those to the various sessions, the poster sessions, the podiums, and so forth, to get them on the program. I'd say there's been discussion over the years about this acceptance rate of 34 to 38%. In that range, should more abstracts be accepted for the meeting and so forth. But AUA has always tried to establish a high level for quality, for example. And that's resulted as a result of that in a pretty rigorous process and accepting just the highest quality science. So that essentially is how the process works. A common question is how is it decided? Is this a podium or is it a poster? And is a podium abstract a stronger presentation than a poster session paper? And that really is not the case. And I'll just give one example. For adrenal, there's only generally about 20 to 30 abstracts submitted every year. And with the acceptance rate, which is pretty consistent across all the topics, 35%, let's say, that means that the adrenal topic turns out to be a podium, which is 12 papers that fit in a podium session. Some of the prostate cancer areas will include multiple podium and multiple poster sessions. Posters generally have 20 abstracts assigned to those sessions. So really it comes down to a matter of making it all fit into the various sessions while maintaining the acceptance rate that I've described. So it's not necessarily the case that a podium paper would be stronger than a poster, for example, and really should not be looked at that way. So I think that is sort of the fundamentals of the abstract review process. I think it's a good process. It does select the best quality science and gives a good result at the end of it all. So I think with that, Dave, that gives an overview of the process. And at this point, I'll turn it over to Stacy, I believe, and you can move to the next slide.
Stacy, I'll turn it over to you. I'll just encourage folks, Stacy, before you start, if you have questions, do feel free to put them into the chat and we'll answer them at the end of the webinar. Dr. Tanaka.
All right. So hi. So I'm a pediatric urologist. So this first question, perspective from a pediatric expert. So, abstracts were submitted for the annual meeting are a little different, obviously, from those submitted to our pediatric meetings. For our North American Pediatrics meeting, people who go to the subspecialty meeting are almost always North American pediatric urologists, with a few exceptions. But for the annual meeting, everyone wants to submit to the annual meeting. And so you end up, there's a lot of overlap in abstracts, but you also see a lot of really novel projects just from different viewpoints. And that's interesting as well. I was also on the JU editorial board for a few years. And so when I'm reviewing abstracts, what I'm sort of thinking about is how easy would it be to turn this abstract into a manuscript? And so, Dr. Pence had already reviewed a lot of these things, but things that kind of help me are, in the introduction, what's the meaningful question this is answering? What's the goal? And just, 1 to 2 sentences. If I look at the methods, do I understand what their process is? And then are there results? So sometimes we'll get there'll be abstracts where it just says data will be presented, and it's very hard to see a manuscript if you see something like that. And so just for me, if I can mentally make the jump from this abstract to becoming a manuscript, I think that's very helpful. So how do we AUA preview and recap meeting content? So AUA News does a general preview and post-meeting reporting. It's print, it's digital on the website, as well as webinars and podcasts. But there's also an opportunity for AUA News to really showcase your work throughout sort of the history of your project, throughout the course of that project. So for example, if you have a small grant to work on a pilot project, AUA News first wants to congratulate you first off, but also have you tell us what you're working on and why it's important. And then once you've had your publication, AUA News can help amplify your results. So, Dr. Denstedt started J Insights, which has summaries of all the articles that go to J, as well as UPJ, or Urology Practice Journal. And so throughout the process, AUA News is just trying to keep that content relevant and alive. And with that, I will turn it over to Dr. Siemens.
Right. Thanks, Stacy. I'm Rob Siemens from Queen's University in Kingston, Canada. Thanks for the opportunity to participate in this really great initiative and chat about this concept of pathway to publication and how it relates to our AUA family of journals. It represents how we've been thinking about the journey of research we're all doing. As everyone on this webinar knows, research papers just don't end up on the pages of a journal. The publication's gone through a great deal of iterations before it gets to a Journal of Urology publication, for example. So starting presentations start at smaller local meetings or lab meetings, discussing methodology and results, tweaking everything, redoing the analysis, and then eventually presented to the broader audience, such as at the AUA annual meeting. And then finally, submission, as Stacy mentioned, to UPJ or Journal of Urology. So we conceptualized Pathway to Publication in 2022 and worked with John to have the editorial team at Journal of Urology review the top-ranked abstracts for the Chicago meeting. And then we sent offers to have their full papers go through an expedited review by content editors as well as statistical editors. Time was tight, but we received a number of very, very high-quality submissions. And the goal was for simultaneous publication at the time of the annual meeting in May, with QR codes available to link to the full-length paper online, press releases, in order to carry on the conversation and amplify the work of the authors. I honestly was just hoping for at least one, but we ended up publishing 10 articles, including several randomized controls trials and a number of other really well-done opinion pieces. So we plan on repeating this moving forward and expand the concept, really, as there's so much good work being done through the AUA meeting. And there's likely a home for solid final papers, just as Stacy was envisioning, at any one of our family of AUA publications. And I know we have an incredible team that can best disseminate and amplify that work. Again, David, thanks for the invite for being here.
Great. Thank you, Rob. And thank you to all the panelists for your presentations. So right now we're going to open things up to question and answer. What I will ask you all to do is, if you have a question, type it into the chat, and we will try to get to as many of your questions as we can. We probably won't get to all of them, just for the sake of time. And what we'll do is we can sort of I'll sort of read the questions off as I see them, and call perhaps on a panelist or answer it myself. So we'll start with, do you accept results from preliminary data? And I will ask Dr. Denstedt to share his thoughts on that if he could.
Yeah, thanks, Dave. So yes, that would be certainly acceptable, having preliminary data. Quite often is, actually. And, as long as it's not too limited, for example, kind of case reports. And just to speak to case reports, those are usually don't rank highly, of course, in the overall submission process, a case report. But interesting, novel, creative preliminary results are perfectly acceptable and of interest to the audience at the AUA. So the answer to that is yes.
Right. Thank you, John. Another question I see here in the chat, which I think is a great question and something that Rob and I have been emailing about back and forth now for some time. Can an abstract be submitted for review if it's based on a recently published peer review paper? And Rob, I'm going to put that one off to you.
Thanks, David. Yeah, we've been having a lot of conversations about this. Can an abstract be submitted if it's based on a recently published paper? No, specifically not. I mean, obviously the goal of presenting at the AUA meeting is have some novelty, new work. So if it's already published by the time submission time comes, it really should not be presented at the AUA.
Thank you. I would add that if it's not been accepted for publication and you submit the abstract at that point, that's completely reasonable. But if it's already out, I think, as you alluded to, Rob, I think that's clear. So I just want people to understand that just because it's submitted, if it has not been accepted, then it's okay. Another question we have here was about video submissions. And basically, it says, how should we go about adding audio narration or any low tone music to a video submission? And the answer to that question is you can add audio You can record it and upload it directly into the PowerPoint for the video submission. And that's totally acceptable if you think that's appropriate. And the next question is around how we select abstracts, podium versus poster. I'll ask Dr. Tanaka to weigh in on that a little bit, and I can always add to it as needed.
Yeah, I think so. When going through the abstracts, there's a scoring system, but I think as Dr. Denstedt said, it's not always by the scoring system that determines whether something's a podium or a poster. I think both are great opportunities to be able to present the work. The nice thing about having a poster too is it's there after the fact as well, so people can take a deeper dive to look at it. So I don't think one's better than the other.
Right. Thank you. I don't have much to add to that. I think that is a really a good answer to that question, and sort of, I think, reflects what all of us think. There's a question about whether or not the process is blinded. Dr. Denstedt, you want to take that one?
Sure, Dave. And the answer to that is yes. So the abstracts are blinded in terms of authors and institutions. I mean, it's a bit similar to a publication submitted to a journal. Occasionally, it can be figured out if they happen to mention our previous paper at our institution, and there's the institution. But all effort is made to blind the abstracts actually for the reviewers. It's part of the process.
Right. Thank you. A bunch of questions that we're getting now. I'll take one or two of them. The simple yes/no questions. Are meta-analyses acceptable? The answer is yes. That is a form of research, but you do have to put your abstract together in a way that the reviewer understands what you did. Are case series acceptable? The answer is, in general, we're not looking for case series. And so, pardon me, case studies, as I say, case series, single-arm case series are acceptable. But a single case study, case report is probably not the way to go. We are going to start a separate program for this. There'll be another opportunity for case presentations in a different setting in the AUA, but that's probably not the way to go here. Do you need to be affiliated with an institution to submit an abstract? No, you don't. Here's another question that I'll pass off to my friends here. How should a submitter select the topic for study? Rob, you want to give an answer to that? So how do you decide which category do you put your abstract into?
That's a really good question, because sometimes there's whatever project you're doing, it could actually fit into a number of different ones. And I think I personally tell my trainees to think about who the audience is going to be in the room for that grouping of papers. And I think you really want to speak to those, where you want to get the information to. So I think of it that way. If it happens to be your study is prostate cancer, but it's really a health economics type of question, make sure you fit it into a category there. So think about the audience.
All right. Thank you.
Dave, it's John. Yeah, I might jump in a little bit there as well. And people should know that the abstract categories are not static over time. Occasionally, they will change as urology evolves, and new categories will be created, if you like, and at times will be sunsetted. So just to give a couple of examples, in the last 2 or 3 years, new categories were created for global surgery and humanitarian work, which is a strategic initiative of the AUA now through the foundation. A category as well was created for patient perspective, so patients can actually submit an abstract, or patient advocacy groups and so forth, and that's been very, very successful. We created about 3 years ago a category for surgical education, which was an immediate success with, I think in the first year, over 300 papers were submitted to that. And then at the other end of the scale, occasionally some things tend to sunset, if you like, over time. And just an example there is shockwave lithotripsy. For a number of years, the number of papers has been declining there. Eventually, it gets down to a critical point, which is around 20 abstracts, 20 or less. You're in a position where it's, as a standalone, not really a viable category anymore. And that doesn't mean it's totally eliminated. Typically, what happens there, we do have a category for technologies and stone disease. So the ESWL papers would be moved over there. You reframe the categories to be technologies and stones, including shockwave lithotripsy. So you should keep your eye out for new categories that come in over time, like the ones I've described. Diversity and inclusion, another example that was started within the last year or two and was an immediate success with 200 papers, in the first year. So again, keep your eye out for the categories, which can change over time.
Yeah, and this year we've added artificial intelligence as a new category. I would just throw that in because I think that is a very timely topic, and people maybe have research in the AI space, and it'll have its own dedicated space. We'll do a few more questions, and then we'll stop at in about 5 minutes. There was one follow-up question to the manuscript being submitted to a journal. If you submit a manuscript to a journal at the same time submit your abstract to the AUA annual meeting, and it is submitted and it is accepted for publication in the interim, you do not have to alert the reviewers to this. In fact, I almost would prefer you don't, because it'll bias their review. So simply put, as long as it has not been accepted for publication, you can submit the abstract at that point. There was a question about, can you submit abstracts to multiple categories? The answer is no. You choose one category. Reviewers may recategorize your abstract. That is completely reasonable. Here's a general question, which I think I'll ask Dr. Tanaka to answer. What is the best way to select a conference to target for your abstract submission?
So I think that's a great question, and I think it's hard to answer just generally. I think just that would really require, I think, working with your mentors. Like, for example, at a junior level, sometimes the sectional meetings might be more appropriate. Again, that doesn't mean that if you're a junior resident, you can't submit something in the annual meeting. But I think for some specialty meeting, sometimes it's just you're limited in how much you can travel. And so if you're not sure you want to go into that subspecialty, sometimes the annual meeting might be a better one to target. But I think it's a hard question to answer just globally.
Yeah, that's why I threw your way, because it's a difficult question, and I knew you would give a good answer. I think that was a very good answer. A couple more simple questions. Is there a limit on how many abstracts can be accepted by one author? The answer is no. We don't do that. International abstracts be selected as best poster? Any poster that is submitted to the meeting that is the best in the category can and should be selected as the best poster. So we don't look at where the abstract comes from when we do that. There was another question about
Dave,
yes, sir.
Sorry to interrupt again, it's John. Yeah, I can just elaborate a bit on how the best poster in any given session is selected. And this tends to be a little bit different amongst urology organizations, how that is handled. Some groups do it actually prior to the meeting, which then would be based just on the abstract alone, selecting which would be the best poster. At the AUA meeting, it's actually selected on the spot by the moderators of the session at the end of the session, which does allow the opportunity to see how the person presents, how they handle the questions, and so forth. So it's just not based on the abstract submission. Of course, the quality of the science is the thing that's most important, but that's actually how a best poster out of the 20 posters in that session is selected, done by the moderators right at the end of the session.
Great, thank you. I think it's good to highlight that, because it is done differently at different meetings. We are just at about 30 minutes, so I think there are numerous other questions. I don't think we can get to all of them today, but I will ask folks if they do have questions. They are feel free to email AUA staff, me, or any of the other panelists here, and we're happy to try to answer them to the best of our ability. I want to thank everyone. I want to thank the panelists for taking time out of their day to answer these questions. And I want to encourage attendees to submit your abstracts to the AUA annual meeting. This is the largest urology meeting in the world. It's truly a global meeting. And we want to have the latest and best science presented at this meeting. And with that, I'll wish everyone a good day and thank you so much.